Most dog owners do the same thing after a walk. Pick it up, tie the bag, and try not to look too closely. But that small daily mess can be one of the most useful health updates your dog gives you. Changes in color, consistency, frequency, volume, or effort can sometimes reveal that something in the digestive system has changed before other signs become obvious. That does not mean you can diagnose your dog by staring at one bowel movement. Food, treats, stress, medication, and even what your dog managed to steal from the floor can temporarily change what you see. The real skill is learning your dog's normal pattern, noticing meaningful changes, and knowing when the poop is asking you to call a veterinarian. Start with the baseline. For many healthy dogs, a typical stool is chocolate brown, formed, moist rather than dry, and firm enough to hold its shape when picked up. It should not be a puddle, but it should not look like a collection of hard stones either. The amount and number of bowel movements vary with body size, diet, activity, age, and feeding schedule. There is no single perfect number for every dog. What matters most is what is normal for yours. Consistency is usually the easiest change to notice. A stool that is very hard, dry, crumbly, or passed as small pellets may suggest that the material moved too slowly through the colon or that your dog is not taking in enough moisture. Diet can also influence firmness. An isolated dry stool may not be an emergency, but repeated straining, obvious discomfort, a tense abdomen, vomiting, or repeated attempts with little or no stool should never be ignored. Constipation, pain, or an obstruction can look similar from the outside, and a veterinarian needs to sort out the cause. At the other end of the scale is soft or watery stool. One soft bowel movement in an otherwise bright, comfortable adult dog can happen after a new treat, a sudden food change, excitement, or stress. But stool that repeatedly loses its shape, becomes liquid, increases in volume, or sends your dog urgently to the door deserves attention. Diarrhea is a sign, not a diagnosis. Possible causes range from dietary indiscretion and parasites to infection, medication effects, inflammatory disease, and problems outside the intestines. Mucus is another clue. A small amount can appear when the large intestine is irritated. You may also see frequent trips outside, urgency, straining, or several small stools instead of one normal bowel movement. A single trace of mucus may disappear, but repeated mucus, especially with blood, pain, or ongoing diarrhea, should be discussed with a veterinarian. Now look at color. Normal brown comes from the way food and bile pigments are processed through the digestive tract. A brief color shift can come from something your dog ate, which is why context matters. Still, some colors deserve more caution than others. Bright red streaks or drops usually represent fresh blood from the lower digestive tract, rectum, or anal area. Straining and colon irritation can cause it, but fresh blood is not something to dismiss as normal. A tiny streak once is different from repeated bleeding, a large amount of blood, or bloody diarrhea in a dog that is weak, vomiting, painful, or refusing food. Those combinations require prompt veterinary guidance. Black, shiny, sticky, or tar-like stool can represent digested blood from higher in the gastrointestinal tract, such as the stomach or small intestine. It may look darker and more uniform than stool that simply contains a dark food ingredient. Because internal bleeding is one possible explanation, truly black and tarry stool warrants a prompt call to a veterinarian, particularly if your dog also has pale gums, weakness, abdominal discomfort, vomiting, or a recent history of medication use. Yellow or orange stool can sometimes follow a diet change or rapid movement through the intestines. Persistent yellow or orange stool, however, may be associated with altered digestion or problems involving the liver or biliary system. Pale gray, clay-colored, or unusually greasy stool can also point toward problems with bile flow, fat digestion, or the pancreas. These colors cannot identify the cause on their own, but they are worth documenting and reporting if they persist. Green stool may come from grass, strongly colored food, or faster intestinal transit. Very dark green can also be confused with black, so good lighting matters. If the color is unusual and your dog is ill, or if there is any chance of toxin exposure, do not wait for the next bowel movement to decide what to do. Contact a veterinarian or an animal poison service immediately. White material deserves a closer look, too. Hard, chalky stool may be linked to diet, especially diets containing a large amount of bone or mineral material. Small white pieces that resemble grains of rice can be tapeworm segments. Long, spaghetti-like worms may be roundworms. But many parasites cannot be seen with the naked eye, so a normal-looking stool does not rule them out. Visible worms or suspicious segments are a reason to collect a sample and arrange veterinary testing rather than choosing a dewormer at random. Frequency and volume can be as revealing as color. A sudden increase in trips outside, especially with urgency, straining, mucus, and only small amounts each time, often suggests irritation in the large intestine. Larger volumes of loose stool may reflect a problem higher in the digestive tract. These patterns help a veterinarian decide which questions and tests matter, but they are not a home diagnosis. Repeatedly thin, ribbon-like stool can occur when the passage through the colon or rectum is narrowed or painful. One unusual shape may simply reflect how the stool was passed, but a persistent change should be evaluated. The same is true for repeated squatting without producing stool. Owners sometimes mistake urinary straining for constipation, so observe carefully and seek urgent help if your dog may be unable to urinate. Before calling the clinic, think about the full story. Was there a new food, rich table scrap, chew, bone, garbage raid, boarding stay, stressful event, medication, missed parasite preventive, change in water source, or chance to swallow a toy or fabric? Is your dog eating, drinking, playing, and sleeping normally? Is there vomiting, weight loss, fever, pain, bloating, weakness, or a change in thirst? The poop is one clue inside a much larger picture. Age and health history also change the level of concern. Puppies, very small dogs, seniors, and dogs with chronic disease can become dehydrated or unstable faster. Contact a veterinarian promptly for repeated vomiting or diarrhea, fresh blood, black tarry stool, severe pain, a swollen abdomen, pale gums, collapse, marked lethargy, refusal of water, suspected toxin exposure, a possible swallowed object, or repeated straining with little or no output. For a single mild change in an otherwise normal adult dog, close observation may be reasonable, but do not let a temporary improvement hide a pattern that keeps returning. Chronic or intermittent stool changes can still matter, especially when paired with weight loss, appetite changes, or reduced energy. Never give human antidiarrheal medicine, leftover antibiotics, or another pet's medication unless a veterinarian specifically directs you to do so. You can make the veterinary visit more useful with simple evidence. Take a clear photo in natural light. Note the time, color, consistency, frequency, and any blood, mucus, foreign material, or visible parasites. Write down recent foods, treats, medications, and unusual exposures. If the clinic asks for a sample, collect a fresh portion in a clean, sealed container or bag, label it, and follow the clinic's instructions for storage. Wash your hands and clean the area because some intestinal parasites and organisms can spread through feces. The most important rule is simple: do not judge the poop alone. Look at the dog. A strange stool from a cheerful dog may be less urgent than a nearly normal stool from a dog who is weak, painful, or vomiting. Your job is not to name the disease. Your job is to notice the change early, preserve the useful details, and get professional help when the pattern or the dog's condition says it is time. So the next time you reach for the bag, take one extra second before tying it. Color, consistency, frequency, and effort can turn an unpleasant chore into a quiet act of preventive care. Your dog cannot explain what feels different, but sometimes the evidence is already waiting on the ground.